First of all, good afternoon, and thank you very much for inviting me. It's a pleasure, and it has been a pleasure this morning. I've been watching some of the presentations, and I think everything that I want to say is said already, so it saves me a lot of work. So I'm currently the head of training, research, and innovation at Luz Saúde. For those of you who don't know what Luz Saúde is a private healthcare group in Portugal, a smaller one compared with others that we've seen this morning. Still, we're first or second largest private healthcare group in Portugal. It depends on how you measure it. So we are composed at this point by 14 hospitals, 13 private outpatient clinics, 2 senior residents, 1,600,000 beds. And almost 14,000 workers working here. These are numbers from 2021. We don't have the 22 as of yet, but we already have a considerable amount of consultations and surgeries. And in fact, we are the leaders in deliveries in Portugal. We are organized in a physical but also digital manner. So we not only have all of these, the hospitals and clinics, we also have a very strong digital hospital. And we try to provide all the types of care, integrating all of these channels. We have an organization of kind of hub and spoke organization at the center, the most complex private hospitals, and then the service clinics, outpatient clinics that will always refer patients to these complex hospitals. Our flagship hospital is in Lisbon. It's called Hospital da Luz. And it's already a good size, medium-sized hospital for Portugal standards, technologically advanced. We have 4,400 beds, 50 critical beds. It was recently renovated and we doubled the size, and we included in this renovation a 15 square meter space dedicated to innovation and simulation center that I'm going to talk a little bit about. With this experience, we have come to terms with the fact that healthcare is inherently complex. We have complexity at many levels, as all of you know very well, starting from the disease complexity, and something that is also accelerating as we get older. All of the diseases, we have new diseases, we have diseases that are connected together. We have more and more multimorbidity, more chronic diseases. We also have diagnostic complexity. Fortunately, we have more and more ways of diagnosing, but then what to use and when adds a lot of knowledge to do in an efficient manner. Treatment complexity, of course. Should we give medication? Should we operate on? Even medication, we know that not always works the same way across patients due to the way we do clinical research. And then we also have workflow complexity. And as a good illustration of this workflow complexity and what this involves, this is work done internally at Hospital da Luz, showing the communication networks between healthcare professionals while providing care for, in this case, a patient with back pain. So each of these lines represents a connection between the patient and a healthcare professional or different healthcare professionals. And I think this is a good illustration. I'm not going into detail, but this is a good illustration of the network of professionals that have to be involved in a patient like this. Of course, it's a complex pathology oftentimes, but still I don't think when we think from the outside that the complexity, even at the level of how many people are involved, is this big. And it's always I think insightful to look at this in this way. Oops. And so this has led Luz Saúde a few years back to do a few things. The first one was to rewrite the mission, and because of all of this complexity that we became aware it existed, we needed to refocus the way we were looking at healthcare, and we very much wanted to include the fact that in the end, again, reinforce that in the end, this is all about people, and this is all about patients and the professionals that take care of these patients. And so we included what is in bold in this mission, So look achieving the best outcomes, but from the patient perspective, and also being able to build an organization that is able to attract, develop, and retain these exceptional people. At the same time that we did this, we also try to look at all of this complexity. Of course, it has problems, but it also has a lot of opportunities. And we felt that we needed to change the way the internal culture of the company, and that from what we were known at the time of being a group that was technologically advanced, and we had we were the first to have a Da Vinci robot, and we were the first to have the 3T Tesla MRI, but we wanted to go beyond that and really start to cultivate this culture of being an innovator inside the company. And to do this, we first created a small company inside the group, so called Hospital de Luz Learning Health. And in this small company, we really united all of the components that we think will contribute to get this new positioning as innovator. And this company, what this company is supposed to do is help developing a good culture, basically a culture where growth mindset is of order, where we are able to have a safety culture, psychological safety, and that people are not afraid to do different and to decide, and are in fact incentivized and are given the tools and the resources and the structure to do that. That where we are also able to identify, understand, and rigorously define what are the right problems that we need to solve, and then to a lesser extent, but also important to actually find some good solutions, and sometimes even to try to implement them. Even though I would say what we focus majority of our time is really on this development of a good culture. So what is this? How does this happen in practice? Well, the first thing was kind of define what would be the functions that would be included in this company. So we united the training, the research, innovation, supported by a simulation center. In this simulation center, where you see some pictures here, we have basically what the typical simulation center is a replica of the hospital, with all of the equipment and all of the clinical equipment and the simulation equipment that allows us to really create the environments that we see inside the hospital, or even sometimes a house of a patient, depending on what we are simulating. And this environment provides a safe testing lab for both for training, for research, and for innovation. And so our first mission here was really to create what we call the healthcare professionals of the future. And we, after some reflection, thought that these healthcare professionals of the future have to do three things very well. First, they need to work as teams. So it's less about the individual and a lot more about the team. And it's the only way really to deal with all the complexity that we see. Have to be able to understand technology, particularly in the times where we know artificial intelligence is everywhere, but we need to be able to look at it critically and also to integrate it in our practice, and also should not be afraid of change and really need to cultivate this positive change and be able again to identify the opportunities of change much more than looking at only from a negative standpoint. And so what are we doing in this school of healthcare professionals of the future? Well, first, we're connecting generations. We have a few programs where we put our teams, our clinical teams and our customer service teams in contact with high school students, for instance. This is an example that we have. And so we bring high school kids to the simulation center for a week-long program where they learn about what is a hospital, what is healthcare. And in doing this, so this is two sides, right? Not only it's helpful for them, but it's also good for us, because we remind ourselves of why we wanted to do this in the first place and what motivates this and the impact that we can have. And this happens because we have to explain this and we have to show this to these kids. The second thing that we also did was together with Catholic University in Portugal, create the first private medical degree in Portugal that is now in the second year. And this is a degree kind of innovative in Portugal. It was not the first one to use problem-based methodology, but it's the second one, and it's doing it in a very solid way. And what we want to as well is to kind of reinvent a little bit of how the teaching happens and connect it more to the challenges that we see nowadays into the future. And so basically create maybe a different breed of medical doctor, maybe more of a, not so going to engineering, not from the engineering side, but from the medical side. So what we want to do more around the 4th to 5th, 6th year is really to start giving these kids a more knowledge about artificial intelligence, about digital health, so that they should start to learn this very earlier on than happens nowadays. We also have implemented and are implementing a lot of different training paths for the staff in our hospital. So not only medical doctors, but nurses and all of the professionals that work in a hospital. And we basically look at all of the learning areas that we should look at. So it's not only clinical technical skills, but we also try to give them tools on how to think critically, how to decide between when they don't have enough information to decide in a easier way. A lot of focus on human factors, and I know we have another talk about that. So training them to communicate well, to work as teams, to assume leadership when it's needed, also giving them some management tools and to train them in scientific methods. So this is an example of what we do in one of our training paths. So first we have a training path, and I'm sorry it's not translated completely, but we start from when the professionals enters the hospital. In here, we assuming that it's just out of school. And so we divide this career inside the hospital in many levels, and in each level, we will have a different training program that will integrate more leadership and management as we go along, because in the end, at some point, all of them have to be managers. And how do we do this? We do this first in an integrated manner. So this is, for instance, an example for the first 9 weeks of one of these professionals when he starts in the hospital. So we first teach them or show them what is the hospital, what is expected of them, what tools and platforms they need to use. And this is the case for the customer service desk employee. Then we assess what he learned, and then we are going to show him where he's going to work, what he needs to do, and we will have for the next few weeks, he will come and go from where he's really working to the simulation center to implement this cycle of learning and applying and being able to get feedback on what he's doing well and what he should improve. And finally, also in this training path, what we did was, again, going back to our mission, show them what the hospital is like from the viewpoint of the patients, so that they really are aware of not only of what they have to do, but also on the impact that they're having on the client, on the final client. In the simulation center, we created the simulated service desk when, again, they can learn and practice all their skills in a safe environment. And we also dedicate a lot of effort to train the trainers and their mentors. So all of the team where they're going to be integrated in also comes to the simulation center. They have practice scenarios. They really prepare well to receive then these new people in their services, and they have this special training to know how to train them. And this is also, we found, has been amazing for motivation of these people. Many of them have been in a hospital for a very long time, and the fact that they are now getting this training and having this level of responsibility in integrating these new people that come into the hospital is really giving them a sense of purpose yet again. Also, and very briefly, I'm not sure how long I have now, but we also, as I said, a few more minutes. So it's just 3 more slides, so I'm almost done. as part of all of these, and as I mentioned, it's very important to create this innovation culture to really promote scientific thinking, understanding what the problems are, defining these problems, and also kind of pass on this responsibility to people to really find how to solve them, even if they don't really solve them, but think about how difficult things are sometimes and how would they come about to do that. So we promote and incentivize research in the hospital using artificial intelligence, but also plain clinical research. And so we have more and more created the conditions to have people doing research. And nowadays we have kind of a mini research center inside the hospital. Finally, we also think, and more, we are also becoming aware that exposing people to the outside world is extremely important, of course. Having these people from outside, these innovators, the startups, coming to the hospital, talking with our people, showing us the products that they are creating. Many of them will be impossible to use, at least in the short term, but this always motivates people to know that there's another way to do it, or to motivate them to think differently as well. And this is something that we also been promoting and incentivizing. And we've had a lot of startups coming to the hospital and testing their products with us. And just to finalize, again, I think it's really worthwhile reinforcing the importance of these networks that we create. So, of course, we have our business ecosystems, and we are a private healthcare group, but really dealing with these open innovation ecosystems, and in particular also with these knowledge ecosystems, the universities, the research centers, this has been extremely important for us and has really started to make a difference in how people, in our motivation of our people. And I think we're very much in the beginning yet. This is long term, all of this, but we're starting to see a few changes in this in our culture, and we're starting to see people that are getting more motivated. Unfortunately, I don't have hard data to show you. Many times because we don't have this hard data collected yet, but it's something that we're going to start doing very shortly, because we really think that some of the things we're doing are going to be good to share with other people, but we know only with evidence we can really do that. And so maybe one day I'll be able to come here and show you some hard data on some of our initiatives. Thank you very much. Very open to questions that you might have.